afternoon, everyone, and thank you all for being here. We are joined today by Michael Carbonargi, Regional Director of the Department of Health and Human Services, as well as Kalitha Williams, Outreach and Advocacy Manager for AARP, Tanisha Hill, the Clinical Manager of the Western Reserve Agency on Aging, and Samantha Brooks, retired activist of the Ohio Alliance for Retired Americans. 1 year ago today, on August 16, 2022, President Biden signed the Inflation Reduction Act, or as we refer to it as the IRA. Today's roundtable is to discuss how the IRA is benefiting seniors and how people can utilize these benefits. We're recording this discussion, and after this roundtable, we'll also post this webinar online so more people can see it. Now, the IRA is one of three bills that I call the trifecta: the Bipartisan Infrastructure Law, the CHIPS and Science Act, and the IRA together have spurred historic investments, created jobs, and helped bring down costs for the American people. This trifecta, which was done by House Democrats and President Biden, has helped rebuild our economy from the bottom up and the middle out. Lowering inflation and bringing down costs is such a big part of that equation. And we all saw how costs went up during the pandemic, how we had supply chain issues and shortages and all kinds of disruptions. Well, those things were also creating rising costs in healthcare that predated the pandemic. And as everyone on this panel knows, healthcare costs hit seniors especially hard. So we knew these were issues that we had to address. That's why I'm proud to have voted for the Inflation Reduction Act, because we didn't just talk about these problems, we did something about it. The IRA is bringing down healthcare costs for seniors right now. Not hypothetically, not in theory, not according to a model. It's lowering costs for real people here in Ohio right now. First, the IRA capped the monthly cost of insulin for people with Medicare at $35 per month. On average, this saves people in Ohio $502 per year. Second, the IRA provides free preventive vaccines for people on Medicare, including the shingles vaccine, which can cost hundreds of dollars. And when seniors can afford vaccines, when seniors can support preventive health care, they're healthier and their cost goes down. Third, the IRA continued the expanded tax credit that allowed hundreds and thousands of Ohioans to be able to afford health care insurance, which means lower costs nearly every time they go to the doctor. And as I said, these changes and benefits are in place right now. There are more benefits coming. Thanks to the IRA, starting in 2025, there will be a $2,000 out-of-pocket cap for Medicare prescription drug coverage. And starting in 2026, we will begin to see lower prices for selected drugs through Medicare negotiations with drug companies. And while it is essential that we lower costs for seniors, we should also note that these changes are ultimately going to benefit all of us. This year, the three largest producers of insulin have all announced they are lowering prices for those on private insurance. That's the power of Medicare to bring down prices. And for the first time, thanks to the Inflation Reduction Act, we're going to use that power. So with that, I want to turn it over to our panelists. Before introducing our speaker, I'd like to share a video with you. Enjoy.
I'm Charlene. I live in North Carolina. I'm on Medicare. I take insulin. And this year, it went from $105 a month that I was paying down to $35. That means a lot to me. When I go to the pharmacy and pick up my insulin, I just have a big smile. Wow, okay, I like that. I called my insurance company to make sure it was $35. And they told me, yes, it will be $35 this year, flat rate for your insulin. And I just yelled and jumped for joy.
Thank you, Ms. Wilson.
It has changed my life a lot. I'm on disability, on a fixed income, and you have to learn how to budget. Any little bit that I can save is a big opportunity for me to do other stuff. Well, I'll have to ask my kids to help me do anything, so I'm more independent. I want other people that's on Medicare to know about this because it's just important to take your insulin when you're supposed to take it. Don't drop it down because you don't have enough money, because the people that's on Medicare, a month's supply is $35 and it's affordable price.
Check your Medicare Part D drug plan to make sure your insulin is covered. Plans and actual savings vary. Visit Medicare.gov or call 1-800-MEDICARE for more information. Produced by the U.S. Department of Health and Human Services.
I'm sure.
This scenario represents so many scenarios that I hear from many members of our community. At this time, to further discuss, I'd like to introduce our first speaker, Michael Carbonargi, Regional Director of the Great Lakes region of the U.S. Department of Health and Human Services. The floor is yours.
Congresswoman, thank you so much for having me here today. And thank you for organizing this meeting and for working to ensure that this community has access to affordable and quality healthcare. Congresswoman Brown was kind enough to host Secretary of Health and Human Services Becerra in Cleveland recently at the Broadway Pharmacy, where we heard from folks firsthand about the impact that the IRA is making in their lives. I also want to thank the National Council on Aging and the Ohio Alliance for Retired Americans for joining us here into pushing us and holding us accountable, and to all the seniors in attendance who will be sharing their stories. Thank you. For starters, we've reached record numbers of health coverage enrollment and the lowest uninsured rate ever. And we're strengthening Medicare for the next generation, thanks to the leadership of Congresswoman Brown and the president's new lower cost prescription drug law. Thanks to this new prescription drug law, the lives of people with Medicare are changing for the better. According to our projections at HHS, because of this landmark law to lower prescription drug costs, about 687,000 Ohioans will save an average of $451 per year on prescription drug costs when new policies, including the $2,000 annual out-of-pocket cap on Medicare prescription drug costs, go into effect in 2025. This is in addition to the tens of thousands of Ohioans who are already saving money on insulin and vaccines because of this successful prescription drug law. The president's new lower cost prescription drug law is helping to connect more Ohioans and Americans to quality healthcare while giving them some extra financial breathing room. This includes, as the Congresswoman mentioned, capping a month's supply of covered insulin at $35 for people with Medicare, making recommended vaccines available at no cost for people with Medicare Part D, eliminating catastrophic cost sharing, capping annual out-of-pocket drug costs for prescription drug costs, and expanding low-income assistance for people with Medicare Part D, allowing Medicare to negotiate better prescription drug prices with the pharmaceutical companies, and requiring these drug companies to pay a rebate to Medicare if they raise prices faster than the inflation rate, and continuing the enhanced premium tax credits that have helped 13 million people covered under the Affordable Care Act save an average of $800 on their marketplace health insurance. Today, fewer people with Medicare are going to be put in the impossible position of having to choose between taking their medication and vaccines and some other critical expenditure, like groceries or their heating bills. Now, specific to Ohioans, in 2022, Medicare Part D enrollees in Ohio spent an average of $372 on out-of-pocket on drugs. And nearly 73,000 Medicare Part B and Part D enrollees in Ohio would have saved an average of $502 per person in 2020 on their insulin costs under the Inflation Reduction Act. But these are real stories with real people. And we just heard from Chantel in North Carolina in the video. Recently in Dallas, Secretary Becerra met with 74-year-old Estella Savage. Insulin was costing her $2,000 to $3,000 per year. When the president's new lower cost prescription drug law went into effect, she couldn't believe her bill. "I think you billed me wrong," she told the pharmacist. "No, we didn't," he said. "Thanks to the new law, your insulin prescription will never be more than $35 a month." The Inflation Reduction Act is delivering real results for real people right now in your own community. And there's more to come. HHS just published revised guidance on how we'll carry out these drug negotiations with the pharmaceutical companies. For example, we're going to be considering the selected drug's clinical benefit, the extent to which it fulfills an unmet medical need, its extent on people who rely on Medicare, research and development costs, production, distribution costs, and other considerations. As of July 1, that same $35 monthly cap on the cost of insulin that applies for people with Medicare picking up their prescriptions goes into effect for Medicare Part B, meaning people who take their insulin with a pump also benefit from the cap. In a few weeks, on September 1, we're going to be announcing the first 10 prescription drugs selected for negotiation, delivering on the president's promise to drive down costs for the American people. And starting in January, nearly 300,000 Medicare enrollees stand to benefit even more from no deductible, no premiums, and fixed lower copayments for certain medications under Medicare Part D through the low income subsidy or the extra help program. Finally, I want to emphasize how important health insurance is to this administration. It's health security. And I want to take a moment to make sure that you have your health insurance. So tell your friends, tell your families, if you have Medicaid or CHIP coverage, even if you think you're no longer eligible, fill out your renewal forms for you and your family. Now that the public health emergency for COVID has expired, annual Medicaid renewals are resumed for the first time in 3 years. We're doing a lot of good work, but it doesn't mean anything if no one knows about it. So good health is one of the most important things in life. Time passes like sand, money comes and goes, but good health is a blessing for all seasons. This is what we believe in the Biden administration and what Congresswoman Brown believes, and this is what we're working towards every day. And with that, thank you very much for taking the time to join us here today. And as we said, spread the word. Your neighbors, your coworkers, your friends and family. The Inflation Reduction Act is working for them right now, and there's more to come. Now it's my pleasure to introduce Kalitha Williams. Kalitha is the Outreach and Advocacy Manager of AARP Ohio. AARP is a valuable partner in getting the word to America's seniors of the many health and wellness benefits of the IRA. Kalitha, thank you for making the time to be here.
Great. Thank you, Michael, for the important work you're doing in our region. Again, my name is Kalitha Williams, and I'm the Outreach and Advocacy Manager for AARP Ohio. Thank you, Congressmember Brown, for inviting us to share with your constituents the historic prescription cost savings provisions in the Inflation Reduction Act. The prescription drug relief that's a part of the IRA is truly historic. AARP led the fight to lower drug prices, and we won. We fought hard for this new law, and because of it, millions of seniors across the country, including here in Ohio, will save money on their medications. So how does this new law impact you and your loved ones? And when will you start getting some much needed relief from the high cost of prescription drugs? Over the next few minutes, I'm going to do my best to provide you with the information to answer these questions. So I have a couple questions for you that you can think to yourself. How many of you are on Medicare? And how many of you take at least one prescription drug on a regular basis? How many of you have had a tough time at some point paying for some of these prescriptions? You folks are the reason AARP fought so hard for the prescription drug relief contained in this new law. And before we go any further, I want to just take a minute to thank the literally thousands of AARP volunteers and members from across the country and here in Ohio who are on the front lines of this battle to lower prescription drug prices. I know some of you are here today in this room. You made phone calls, sent emails and letters, visited your members of Congress, signed petitions, and so much more. Without you, this historic victory would not have happened. So thank you, thank you, thank you. You truly made the difference between victory and defeat. I'm going to quickly go over the key provisions of the new law, and then I'll go back and go into some details on each, plus a few more. I'll also talk about when these provisions take effect and answer the all-important question, when will I see savings? There are 5 major pieces in the law that will finally deliver real prescription drug price relief to millions of Americans. First, the law allows Medicare finally to negotiate the price of prescription drugs. That alone is huge, but there's more. Second, the law caps annual out-of-cost prescription drug pricing in Medicare Part D at $2,000. Third, the law caps co-pays for insulin to no more than $35 a month in Part D. Fourth, it makes many vaccines, such as for shingles, available at no cost under Medicare. And fifth, it holds drug companies accountable when they increase drug prices faster than the rate of inflation. So many of us, many people, even if you're not diabetic, have diabetes, you know someone who does. And we've known people who've had to ration their insulin or choose between paying their medication or other important necessities. We know that insulin users spend up to $100 per prescription, which is 50% higher than the new benefit of a $35 copay. People in Medicare Part D spend $1 billion in insulin in 2020. I want to note that not every plan covers every type of insulin, so make sure your plan covers the insulin your doctor prescribes, or ask your provider to suggest an alternative that may be covered. And as previously mentioned, free vaccines in the new law protects Americans with Medicare Part D from shingles. We know that the shingles vaccine is 97% effective in preventing shingles in people ages 50 to 69 and 91% effective for people ages 70 or older. 1 million people get this vaccine a year. So beginning this year, drug companies will start to pay penalties for big price increases. Drug companies that increase the prices of their products faster than inflation must pay the higher than inflation amount back to the government. For example, if inflation were 5% and a drug price increased by 6%, the drug company would have to pay the 1% difference for all Medicare sales for that drug back to the government. We believe that this provision will put the brakes on drug companies' longstanding practice of dramatically increasing prices year after year. And also this year, as previously mentioned, vaccines are free for Medicare beneficiaries. You'll have absolutely no copay for many Part D covered vaccines that currently require cost sharing, such as the shingles vaccine. If it's a vaccine that's recommended for adults by the CDC, it's free. And again, we've noted the additional support for people who need insulin. Beginning in 2025, you will not have to pay any out-of-pocket costs for prescription drugs once you hit an annual cap of $2,000. That's $2,000. That's a big change and will make a major difference in affordability for so many people. In 2026, that's the year that people with Medicare will begin to benefit from Medicare's ability to negotiate with the drug companies for lower prescription drug prices. For decades, you've been held hostage to drug companies charging you out of control prices for medications you need to stay healthy, but not anymore. It's estimated that Medicare's new negotiating power will save taxpayers and Medicare nearly $300 billion over the next 10 years by lowering the cost, lowering out of control drug prices. That's right, $300 billion with a B. The negotiation process will include a ceiling for drug prices to ensure that Medicare is on equal ground with private insurers, never paying more than what the private insurers have already negotiated. And this is such a common sense measure, but has been long overdue. And big drug companies have fought it for decades. Think about it. This provision allows Medicare to use its massive buying power to negotiate better prices for its members, just as Costco, Sam's Club, and even the Veterans Administration all do. And just to reiterate, there's another part of the law that we'd like to touch on that's not specific to prescription drugs. The Inflation Reduction Act continues financial assistance for low-income adults who buy their health insurance through state and federal exchanges. That assistance was set to expire in 2022, but now will be continued through 2025. If not for this extension, more than 3 million Americans might have lost their health care coverage because they couldn't afford it. And lastly, we wanted to share some upcoming events of AARP events in your local community, and you can engage us directly. We will be sponsors of the Cleveland Orchestra in the Blossom Music Center events on August 19th and 26th. During those events, we will have a Social Security trivia game, which is very similar to the Plinko game in The Price is Right. And we'll be offering prizes to people who play and share their Social Security trivia. We will also be sponsoring the Greater Cleveland Urban Film Festival in mid-September at Atlas Cinemas. And we're also a sponsor of the Cleveland National Air Show at the beginning of September. In the next coming months, we will be offering presentations in the community focused on fraud and how to prevent and reduce scams in our community, as well as additional training about understanding benefits for Social Security. And you can learn more about these events by visiting our website at aarp.org/OH. And at this time, I'm going to introduce Tanisha Hill, who's the clinical manager of the Western Reserve Area Agency on Aging.
Good afternoon, and hello, everyone. I want to thank you, Congresswoman Brown, for having us on this meeting today to commemorate the 1-year anniversary for the IRA. And thank you to those of you who are also attending to hear about how this is affecting those of our members out here and our consumers, which I'll be using those two words interchangeably just so you're aware. And how that affects them and will affect them. So to start, my name is Tanisha Hill. I'm the clinical manager here at the Western Reserve Area Agency on Aging. I am going to tell you a bit about how what our agency does, the clients we serve, and present a few facts and figures and discuss how the Inflation Reduction Act, or IRA, helps our Medicare beneficiaries. So the Western Reserve, we're a private nonprofit corporation. We were organized and designated by the state of Ohio to be the planning, coordinating, and administrative agency for federal and state aging programs in our 5-county area, which includes Cuyahoga, Geauga, Lake, Lorraine, and Medina counties. We are considered the planning and service area, AKA the PSA 10A. So our mission is to provide choices for people to live independently in the place that they want to call home. And our vision for our agency, is that we aim to create a community that provides aging individuals and people with disabilities the opportunity to have their needs met with optimum choice, dignity, and maximum independence. So my role here at the Western Reserve is, as I said before, is I am the clinical manager. We have multiple programs here that service our elderly individuals as well as our disabled. And we contract with 3 managed care organizations for the MyCare Ohio program. I oversee the CareSource MyCare program, where we have close to 4,000 members that we service, providing case management and waiver service coordination as a dual role. So we're pretty busy these days trying to make sure that our members are staying home and staying out of the facilities as much as possible, that we're keeping them, out of the hospitals, and making sure that we're getting those services in the home so that they can age in place. So everything that this today that we're talking about, we are taking servicing all of those consumers and those members on the spectrum. Okay. So a few numbers to be mindful of before I go into discussing the Inflation Reduction Act. So in Ohio, we know that over half of Medicare beneficiaries are living with 3 or more chronic conditions, which likely means that they are taking at least one medication, if not more, to help manage those health conditions. Our counties here at the PSA 10A in our 5-county service area, they want to take control of their health by managing their medications and health conditions and planning for good health by way of preventative measures such as the vaccine. So this is where the vaccines really come into play and help with that prevention and keeping our members healthy. But many also need help, navigating the healthcare system and balancing healthcare costs with other expenses. So, in our particular area for the MyCare CareSource area, we do work, again, with as a delegate of the managed care organizations to help members meet their goals for their healthcare needs as well. But not to mention, our clients are also caregivers. And many of our caregivers are also spending money out of pocket on their caregiving responsibilities. Some of them may struggle to choose between spending money to help care for their loved ones or paying for their own expensive medication. So yes, while this affects those members or consumers that we are serving out in the community, we also need to take into account their caregivers. Let's see. Some of the caregivers, again, like I said, have to choose between, taking care of themselves and making sure that the person that they're taking care of have their needs met. And when they have to make those hard decisions, it has a trickle-down effect. It either affects the member or the consumer in a negative way from a health perspective, or it can help affect the caregiver in a not so good way, meaning that the member or consumer could possibly lose their caregiver. So there's about over 450,000 individuals who are enrolled in Medicare at our PSA agency. And of those, over about a third are enrolled in Medicare Part D prescription drug coverage. Medicare does help reduce the cost of medications, but for those struggling to make ends meet, it can still be a burden. In Cuyahoga County, there are over 240,000 individuals who are age 65 and older. And when we think about that number of Ohioans living with 3 or more chronic conditions, it's no surprise that nearly a quarter of those are Medicare beneficiaries in our country, and they are possibly living with diabetes. So the Inflation Reduction Act considers these statistics, and it has a positive impact on our Medicare beneficiaries in our state and beyond. So how does the Inflation Reduction Act affect our Medicare beneficiaries and caregivers? The Inflation Reduction Act, it eliminates, of course, the vaccine cost sharing for Medicare Part D beneficiaries. So all, if not most, vaccines are free for those Part D beneficiaries. This is very important, as we said, for preventative health. And then for those 23% of Medicare beneficiaries in Cuyahoga County that do live with diabetes, they will see their copay insulin, as previously mentioned, capped at that $35 per month, which again is less than, about 50% of what people are currently paying for their insulin. And we haven't even talked about the other parts, which is the supplies and things of that nature. So starting in 2025, those that are enrolled in Medicare Part D will also see their annual out-of-pocket costs capped at that $2,000 for prescription drugs, again, as previously mentioned. They will also have the option to break that amount up into affordable monthly payments, which allows them to stretch their budget. So what I'm going to add as a side note here, thinking about all of our members and consumers that we serve out here in the community, we do see where there's times that our members have to choose and have made a decision on their medication or their insulin, or getting their lights or their utilities cut off, or not being able to buy groceries. And as I said, when you talk about the caregivers who can be affected by this too, and it having a trickle-down effect, this too has a trickle-down effect. Part of managing your diabetes is having a proper diet. If you can't get the foods to have the proper diet, then you have to adjust your insulin, and most people do not do a very good job of adjusting insulin, and that results in hospitalizations. If we think about members or our consumers who can't get the medication, but they choose to have the foods, but then they may have not so great diets because that's all they can afford is the foods that are not the best, and they may not have access to the healthier foods, and that too will affect them being able to manage their diabetes because they may not have the insulin, or they may be taking considerably less insulin to ration. So those are some of the things that we still continue to face in the community, and something that we are seeing often with our members and our consumers out here. So at the beginning of 2026, Medicare negotiated prescription drug prices will go into effect, which will help reduce the cost of some of those certain high-cost drugs and out-of-pocket costs to older adults. For our caregivers and our other Ohioans who are considered low income, they will see their marketplace premiums reduce as well as receive financial assistance to help afford their prescriptions. So with that, I would like to thank you, Congressman Brown, and I would like to thank those of you attending. If you would like to get in touch with our agency and to get more information about any of our programs, and we have many, you can contact our agency via our website at areaagingsolutions.org. Thank you for your time.
Hello, I'm Samantha Brooks. I want to thank you for inviting me to join this distinguished panel. It's such a wonderful opportunity for people to learn about the Inflation Reduction Act, how it is going to help them, and how it is going to help caregivers to understand what it is that they can do for those that they care for. Thank you, Tanisha. I am a community volunteer, and I see here I said retired activist, and as I thought about that, I'm not retired. I volunteer for many organizations here in Northeast Ohio, as well as the state of Ohio. The Alliance for Retired Americans is just one of those programs that I have volunteered with. In addition, I volunteered with many of the panelists that are now presenting today. So thank you so much. It is an honor that you have asked me to join this panel. So I'd like to actually start with a poem that I adapted from Who Will Cry for the Little Boy by Antoine Fisher. And many of us remember that movie, but I am a fierce advocate. And so I am always thinking about who will advocate for older adults. So who will advocate for the older adult that was found in a back room with diminished pride? Who will advocate for the older adult whose loneliness has caused her to hide? Who will advocate for the older adult in her home with no food to eat, unpaid rent, no heat, because she chose this month to pay for medication? Who will advocate for this older adult? Who will advocate for the older adult who feels abandoned, hurt, and alone? Who will advocate for the older adult who cries because her budget has been blown? Who will advocate for the older adult, a stark reminder of our inadequacies? Who will advocate for the older adult when we must deal with bureaucracies? Who will advocate for the older adult if she's forced to walk away from the pharmacy? Who will advocate for the older adult left to fight alone? Who will advocate for the older adult? Which one of you will atone? Who will advocate for the older adult? Will the government step in, step up, and make medication affordable? Who will advocate for the older adult? So this has been a long fight. We have been advocating for lower costs for prescription medications for a long time. We have been advocating even for an outpatient prescription program to be made available to Medicare beneficiaries. Let's take just a brief look at what that road has looked like. So early Medicare proposals from 1960 to 1965. And let me just mention that Harry Truman in 1945 wanted to have a federally funded healthcare program for older adults, but it didn't even make it to a discussion until Medicare proposals until 1960 through 65. It before then was just flatly outright not thought was going to happen. So when this is just a brief look at the proposals that were moved forward by both Democrats and Republicans. And we can see that Democrats then wanted to cover the cost of hospitalizations and under a universal social mechanism. But Republicans wanted a little bit more added to the proposals that they moved forward. One, they wanted it to be a voluntary enrollment, not something mandatory that everyone had to participate in. They wanted the programs financed by premiums paid by the beneficiaries and subsidized by general revenues. They wanted the program to have physician services. And here we see that Republicans wanted to move forward a proposal that would include prescription drugs. However, we know the outpatient prescription drug portion of the proposal was dropped on the grounds of unpredictable and potentially high costs. This was the battle that we would fight for the next several decades until we were able to get a prescription drug benefit added to Medicare. And so we fought in 1988 under the Medicare Catastrophic Coverage Act that we were going to finally have a prescription drug benefit, a small prescription drug drug benefit added to the Catastrophic Coverage Act. So this act was to provide limited coverage that was to start in 1991 for outpatient prescriptions. And here we see also that insulin was added. However, there was a huge uproar by older adults and advocates because the way that the benefit was set up, individuals thought that it would raise the premiums for Medicare Part B tremendously, and the cost of adding the prescription drug to the beneficiary would be too high. And so there was fierce reaction to this, and older adults came out in the thousands and contacted their legislators to say, this is not going to work for us. It was repealed quickly. In 2003, so from 1988 until 2003, while we continued to advocate, it wasn't until the Medicare Prescription Drug Improvement and Modernization Act that was passed December the 8th of 2003 that we finally got a prescription drug benefit added to Medicare. It wasn't it was good, but it wasn't what we all wanted. And we knew that we would have to continue to fight for some of the things in this act to expand and include other things that we thought that was important for older adults, and those things that would lower prescription drug costs. This was a voluntary outpatient prescription drug coverage. Drugs were to be provided through standalone prescription drug plans or comprehensive plans, Medicare Part C. It provided a subsidy for beneficiaries with lower incomes. Some of the issues were that this is a very, and continues to be, a complicated program. And many older adults need help in choosing the plan that is going to work best for them. They had to learn to navigate hundreds of plans, and each year we have to look to see what changes are occurring within those plans, so that older adults will know, can they stay with the plan, or do they need to switch to another plan? It had a coverage gap, which was huge. So this program would help you up to a certain point. After that, you had to pay 100% of the cost for your prescription drugs until you met another level. And then you went into what we called catastrophic coverage, where the plan picked up and helped again. What happened when people went into that, what we call donut hole? Many stopped buying their medications. They ended up back at their doctor's offices, in emergency rooms, and in some cases in the hospital. Insulin was a big part of this. Also, we fought from the beginning and understood that if Medicare were allowed to negotiate the cost of prescription drugs on behalf of Medicare beneficiaries, we were going to have a lower cost. So even though we appreciated the fact that we now had a prescription drug benefit, we knew that there was work still to be done. In 2010, the Affordable Care Act under President Barack Obama was enacted. And what we saw with the Affordable Care Act was a further reduction of prescription drug prices for seniors, because it was going to begin to close the donut hole that was kind of a rope around so many necks of Medicare beneficiaries, and really strung them out and hung them during that phase of the donut hole. We were going to now begin to close this. This made a huge difference in people being able to purchase their medications when they fell into that donut hole. But advocacy continued because we had to continue to educate, as we are doing today, older adults about those elements of the Affordable Care Act that they needed to know in order to make sure that they were purchasing medications at the cheapest cost that was out there. We still needed to show them and to help them to continue to navigate the hundreds of plans that were coming in and changing their plan benefits on an annual basis. We still did not get Medicare, permission for Medicare to negotiate the cost of drugs, and was something that we still continue to work on and talked with our legislators about. Ta-da! And so we now have the Inflation Reduction Act that you have heard today was a great win for Medicare beneficiaries, but the road has not ended there, because we still have many Americans who are consistently frustrated, angered, and baffled with the high price of medications, the difficulty of their being able to afford the medications, the choices that they have to make when purchasing medications. And so while we have some great things that were added to the Inflation Reduction Act, we still must continue to fight to ask for improvements. We still need to have new drugs that come into our system with really high prices. We need to have those prices to come down. We should not see prices where people are having to pay $4,000 for one drug or $4,000 for a prescription. That shouldn't happen. So we need to see those launch prices come down. We need regulations, and we talk about the pharmacy benefit managers, those middlemen who do pass and don't pass in many cases along the discounts that they receive to consumers. We need copays that are going to be lower, because those copays are based not on the negotiated costs paid by the benefit managers, but on the cost of those actual drugs. So we'd like to see some work continued in that area. We know that other countries, companies use the drug patent system to limit competition and to keep prices high. We know that strategic drug patenting prevents companies from making generic drugs come to the market sooner. So we want to work on that. And we know that other countries have done things like the European Union regulating the price of prescription drugs by dealing directly with pharmaceutical companies. Will that help us here in America? That Canada Patent Medicare Price Review Board caps the price of medications based on its price in other countries. Is that something that we ought to be taking a look at here in America? So we still have work to do. We still need people to advocate, continue to advocate on behalf of older adults. I know that when I go into, and now I'm one of those, so I count when I go into the offices of legislators. But when I was a younger person, and I've been working in this field, doing this on behalf of older adults for over 30 years. But I would go in and sit down and start to talk about some of the things that would improve lives and make health outcomes better for older adults. And one of the things that I would hear is that we don't hear from older adults. They are not calling our phones. And so we have you here sitting on behalf of them. We want to hear from older adults. We want to know their stories. We want to see them in our offices. So now when I go in, I can say, you see me. I'm an older adult, and this is what I need. Thank you so much for having me on this panel. And I would like to bring back Representative Chantel Brown and thank her for the work that you have done on behalf of older adults for me.
Thank you, thank you, thank you, thank you, Ms. Brooks. And thank you so much. You definitely are not in retirement. You are on reassignment. Thank you all for your perspectives and insight that you shared. I just want to make 2 points in closing. First, when we talk about lowering costs, that isn't just about money. It's also about peace of mind. It's about well-being. Because of the IRA, there are tens of thousands of Ohio seniors who have one less thing to worry about. I mentioned the cap of insulin prices at the beginning. There are more than 70,000 Ohio seniors on Medicare who need insulin and 17,000 in my district. And I would add, this is a population that is disproportionately Black because diabetes rates are extremely high in the Black community. So this is legislation that really benefits a lot of people. Because remember, insulin prices are just one part of this law. After a lifetime of work, of raising their family, of serving their communities, our seniors deserve that peace of mind. Secondly, across this roundtable, we've talked a lot about money and costs. The Inflation Reduction Act does all this good without raising taxes on anyone making less than $400,000 a year. This bill is paid for by having corporations and the ultra wealthy pay their fair share. And that goes back to our overall philosophy of building economy from the bottom up. So I want to thank you all. I want to thank all of our participants once more. And thank you for joining us. And thank you for all of the work that you do. We will be posting a link to this roundtable on social media. And for more information, seniors can also call 1-800-MEDICARE or visit medicare.gov/extra help. You can also contact my office at chantelbrown.house.gov or by calling 216-522-4900. And I hope everyone has a wonderful day. Thank you.